Good afternoon, everybody. It's another busy day, COVID-wise at Medical Center. We started off with 38 patients this morning in-house. So since Monday, that's almost doubled our COVID load since Monday. Currently, right now, we have 35 COVIDs here. We have tested 450 positive. Of our 35 COVID we have in-house, 21 of those are on 7 Central. That includes 2 from Focus Care Odessa, 2 from Ward County, 1 from Andrews, 1 from Kermit, and 1 from McCamey. On our CCU floor, we have 4 on the ventilators. There's 14 total on that floor. That includes 3 from Focus Care Odessa and 1 from Big Bend down in Alpine. We have 2,413 negatives with 532 pending. No suspects in-house, and we have tested a total of 3,395. And this morning we did open the 8th floor for COVID, and we had 2 patients on there immediately this morning. So I think the big thing to take away from this is since Monday, we woke up Monday, we had about 20 patients, and now we're pushing 40. So we've almost doubled in 4 days time. So Kristen, you want to make any more comments about that situation?
Yes, as Russell said, we did open up the 8th floor so that we are really covering those patients. That gave us another 28 beds of non-critical care availability for any of those patients that might need it. And then, of course, we're now preparing for the critical care, because we know if any of these patients take a downward turn, we need to provide another higher level of service in those units. And so we're preparing an expansion of another 13 to 28 beds for those in the event we were to need it. And we're working through that constantly so that we are ready when those come in through the ER or from their homes as direct admissions.
We did have a call today with our regional partners in the region about how they could help us. When I say us, I mean us and Odessa Regional, about when we get patients that are from counties outside of us, whether that's from Upton County or Pecos County, if they're residents from those counties and we can get them pretty close, 24 to 48 hours of going home, we need those counties to pick those patients back up and let us ship them back home. We all know there's no place like home, but at the same time, you know, the question we received from our regional partners is what can we do to help? And us being able to ship these people that are just about ready to go ahead and get them back home and allow those beds to open back up for more critical patients. So for all our regional partners, I know I speak for us, and I'll let Stacy, I know she does too, but we appreciate y'all trusting us with your patients, and we appreciate y'all being willing to take those back a little bit quicker so we can turn those beds over and put some more critical patients in there. So we appreciate that.
Russell, I'd just like to add before we move over that I can't say enough publicly or behind a closed door how proud I am of the staff at Medical Center. The nursing staff yesterday, the minute we said, hey, we need to really work through this and we need to expand some coverage, all of them, their leaders, the housekeeping departments, the lab groups, they all jumped in, and within a couple of hours had things transitioned and people moved and all ready to go. And the same thing again this morning. So I just want everyone listening to our Facebook Live know that they are the most upstanding group of individuals and they want to do the right thing for the patient. So I just wanted to say thank you.
Thank you, Russell and Kristen. Stacy, would you like to go over the RMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 941 individuals. We have 102 of those who have tested positive, 688 negative, and then still 151 pending. We currently have in-house 9 patients. So that's down from our high this week of 13 on Monday. 4 of those are on vents, and that's the highest vent count that we've had all week. We've been running at an average of 2 for the other days. In terms of what's come in and out of the unit, we did discharge 2 since we talked yesterday, and we've admitted 3 more. So that's all I have, Trevor, other than I certainly want to share the same sentiments that Kristen did in regards to our staff across the board from all units, as well as our providers who are taking care of these patients. You couldn't ask for better people in those positions, and so they are definitely working hard, and they've been working hard. So please include them in your prayers to replenish their strength and keep them going strong. We definitely need them, so thank you.
Thank you, Stacy. Dr. Servanen?
So just a couple more new updates for the ORMC numbers as well. We now have 1 more person on the vent. That's 5. We're taking a vented patient from Big Spring. That's 6. So we'll have 6 people on ventilators, and our count will be up to 11 at least in the COVID unit. Struggling with nursing staffing. Our nurses have stepped up, like Kristen said, but there's only so much of them, and they're working overtime. They're covering shifts they normally wouldn't cover, but definitely need more nursing staffing as well. One of the things that I can ask, in addition to what Russell has already said about the entities outside our county that are willing to take the patients back, I can ask for some help within our county for us to be able to house some of these patients. I'll give you an example. Assisted living facility sent us 2 or 3 patients recently, and their current policy is that they have no way of taking care of COVID positive patients or isolating them. It's a assisted living facility, not a nursing home. And I had a good conversation with one of their VPs today, and the question was, well, we don't have a way to take care of them because they're not staffed with nursing or anything like that. And these patients can't be isolated there. So where else can we send them within our county? So maybe a conversation with some of our community partners that run skilled nursing facilities or long-term care facilities would be a good conversation to have, to say when we are ready to unload from the hospital, because we need to take care of those critically ill, then we have a place to put them that they'll still receive the follow-up care that they need. So that's a conversation we probably need to have as a community, which we will probably early next week.
Yeah, I wanted to ask a question. I've seen a few questions for Kristen and Dr. Servanen, and Stacy even kind of addressed this as well as Russell. We're at the point now where both hospitals are being able to discharge a couple of patients a day, but it's not making a difference in the census numbers as is we're admitting that same number or even more. It's important to stay home if you can and wear a mask. I mean, both hospitals, we're seeing the numbers just consistently go up. Is that not accurate?
That is accurate. Our census is well above what we normally see, and you're right. If we discharge a COVID or a non-COVID, for every 2 we discharge, we get 4 back. So those discharges are coming. It's just a matter of people still becoming ill, whether it be COVID or not. There's other things in our community going around. We forget in the midst of COVID that there's other things and other illnesses going on. And so we are seeing an increase on both sides of the table.
No, it's hard for me to want to tell people to stay home and not get sick, because I like sick people. We hospital admin type, we like to see these people come in. But at the same time, the way that our resources are stressed, our staffing is stressed, we want people to take care of themselves and let us be ready. So when they do need us, we can take them in. But I think the staying at home, wearing the mask, washing your hands, I know we've been talking about it, gosh, for months now, but now more than ever, it's highly, highly important to do that.
Well, thank you, guys. Looks like we got a full. Oh, sorry, Dr. Servanen, go ahead.
Add one more comment to what you just said. We are going to be playing catch up for a couple of weeks. If you think about the incubation period of the virus, the people that we're seeing now were people that probably got infected about a week ago. So even if we choose to make a change today, deliberately, the whole community decides we got to help the hospitals, we got to help our community, we're going to make a change, we're still going to be at least 1 week behind. So the numbers are not going to stop going up over the next 1 week. We're going to see the same thing happen at least for the next 1 week. So we're asking the community to make a change now, so that a week or 2 weeks from now we can be at a point where we're saying, oh, we can breathe now, we can continue to take care of these patients, and we won't have to worry so much.
Good idea.
All right, looks like we got a full house for media, and I just popped Mike up. Mike, go ahead.
Hey, I got a question for from a reader, so forgive me for the anecdote, but so if an MCH employee, say, tested positive and exposed patients and coworkers at an outpatient clinic, are those employees who are exposed, are they only tested if they have symptoms? What would protocol be in that case?
So this is, let me make sure I understand your question clearly, Mike. What is our protocol for testing employees that have been exposed to people that are positive?
Correct.
Is that what you're asking me? Okay.
Yes.
So what we do is we go through a series of questions through health and wellness. And so we have, you know, did you have a known exposure? What symptoms are you experiencing? And so in the event they can wait, let's say 3 days or so of being off work while we have a state turnaround time, then we'll go ahead and swab those individuals through the state testing. And then they'll quarantine until their result comes back. In the event it's going to put a detriment to a unit or a shift, and they're clinically a bedside person or in a specialty type area, we are actually rapid testing them with our in-house PCR testing, similar to what we're doing with patients prior to admitting them. Does that answer what you're asking?
Yes, yes. And if those employees didn't know that, say, one of their coworkers was positive, but they tested positive, would they be contacted in reference to that? And would also the patients who were in the office at that time?
Yes. So anyone that comes in contact with any of our employees that test positive, we do the contact tracing similar to the county. And so our health and wellness department starts down the list. And so we begin those interviews, and then we call every person. Even if we're not sure of a test, we'll go ahead and call all 50 of the patients that they could have come in contact with to let them know that we've had a possible exposure and what to look for and when to come into the facilities and things like that.
Okay. All right. Thank you. Yeah, that answers my question. And is anyone from the county there?
No.
Okay. Does anyone know if masks are required at the courthouse or the annex? I know they are at the sheriff's office right now. So.
I don't know.
Luckily, I haven't had to go
No.
there.
Yeah. Yeah. Okay. Well, that's all right. Thanks. That's the only question I had for the hospital. So.
Mike, we'll put you aside here, and looks like next up I have is Danny. Danny, you there? Okay.
Hold on. Okay. Are the hospitals going out and asking stores, mom and pop stores, and to encourage them to have their staff or wait people wear masks to help bring down the numbers at the hospital? But either
Danny, that's why we're here. That's why we do this. We don't have the ability to go out to each of the stores to tell them that that's the right thing to do. But if I'm out there and if I see something, I'll say something. But this is why we're here almost 3-4 times a week to give this message.
Well, I understand that. I'm just saying, because there's still a lot of people that think that this is still a hoax. I have a friend of mine that thinks this is paranoia. And in fact, my son's sister-in-law has COVID-19. Fortunately, she lives in New York, so I understand the situation. But I was just wondering if, by chance, if there's anyone that would schedule out like an hour or something and target one part of town, one store, and go over or give them information of the importance of wearing masks.
We're not currently doing that either, Danny, on our side. Trevor and his team under all of our marketing department, they have worked really hard, and they constantly are putting out new things about masks and things to do to keep yourself healthy. In fact, they just released one that said do the 5, and it lists out the 5 key things you should do. But we have not gone out to businesses either. We've just been using social media to do that.
Devin's on here. Devin, do you know, has the city have anything like that going on right now?
I'm sorry, I couldn't really hear Danny's question. What was it that he was asking?
Well, my question was is anyone going out to visit stores or restaurants, mom and pop stores and stuff to encourage them to wear masks or gloves to help bring down the numbers in the city?
We're not specifically going out to stores, but I think the city's message has been since March-ish, whenever we started all of this. The city's messaging has consistently been to wear a mask, and just today we kind of put out a fun video because it seemed like we had tried every approach, maybe a more serious video or maybe kind of one to, incite some fear just to show you, if you could see the virus, and that wasn't really getting anywhere. An emotional take wasn't really getting anywhere with that. So today we got a fun one, but our messaging has consistently been wear a mask. It's not about me. It's about, the other people in your life who could react differently to this virus. So to answer your question in a short way, no, we're not going out to mom and pop stores. Maybe that's something that we can do. I think the county was starting to think about some sort of plan, or Mr. Shelton had talked about a plan of going to the stores and having something, but it's not something that I've seen come to fruition.
Okay, that's all I have.
Thank you, Danny. All right, next up is Scott. And Scott should be coming up.
There I am. You got me?
Yes, sir.
Midland Memorial announced this morning they've got 41 staff members positive. Are either of the hospitals having that kind of issue over here?
Yep.
Yeah, this is Stacy. We currently have 9 individuals who, 4 of which have now been tested and confirmed positive. The other 5 are still pending. All of those are community-acquired cases. And so our number's 9 in total that we have out.
Ours is higher than that. We're in the 30s with those, and those are all. That's from day one. That's not necessarily 30 today, but some of those can be 2 or 3 weeks old. Some of those can be 2 hours old. But and the community acquired is definitely what's hitting those employees.
Like Mike, I have an anecdote, and just let me read it to you. We're told that employees at MCH who've tested positive for COVID-19 previously had to have 2 negative tests before returning to work, but now there's a new policy that switches to a symptom-based strategy. I guess, Kristen, that's a question for you. Is that true, and how's that working?
We have. Yesterday, we rolled out a change in our return to work. The CDC gives us 2 options as healthcare providers. You can either do the testing-based method, which we were currently doing, or you could do the symptom-based. And the symptom-based is that you have to remain, you have 10 days of quarantine following your first exposure or your symptom or your test being positive. And then if you, after those 10 days, have a 72 hours worth of asymptomatic, then you can return to work wearing your PPE. We added that to be 14 days. And so what we're telling our staff is if you have been 14 days and you've met your quarantine, that although you may test positive, again, if we were to continue swabbing you, if you've been asymptomatic for those 72 hours, you may return to work. We have a universal mask policy, so everyone is in a mask, and we're rolling out that every employee takes a temperature upon arrival to work. So we'll still continue to be screening them, and any symptoms that they show or change in condition when they return to work, then obviously we would put them back at home. And that just went out yesterday.
And Scott, I just shared with you a file in the chat box that's from the Texas State Department of Health, which describes both strategies and all the information. That's the minimum, and we may take that and make it even broader if we need, which is what it sounds like MCH has done. We've had that same strategy right from the very beginning. But we haven't had a problem with getting 2 tests back before bringing them so far. But now when tests are taking this long to come back, hey, we might go to the symptom-based as well.
And it's
sorry. No, go ahead.
No, I'm saying that we're really looking at the symptoms, and while we understand the concerns, we also have to look at the general operations as well, because some people can very well test positive for 4 to 6 weeks later. I mean, people still have this, but they are asymptomatic. And so we have employees that are sitting at home and they ask us, well, all I'm doing is sitting here. I could be working. So that's one of the things that we took into consideration as well.
Gotcha. I just got a tweet, and I haven't been able to confirm it yet, but it looks like the governor has issued an executive order requiring the whole state to wear a mask, all counties with 20 or more positives. So I think our questions have been answered this afternoon.
The whole, like a state mandate?
Yes, sir.
Wow.
But that just came in, and like I said, I haven't been able to confirm that myself.
I've received 2 emails already regarding that as well, Scott, so it looks like that appears to be the case.
Any thoughts on that, Dr. Saravanan?
Mm-hmm.
I was just trying to look at the governor's website to see if it's true, and I think it's like I said once before when you asked me this. Well, it's about time. So there you go. Well, it's about time. Like I said, even if we make this change today, we will still see effects of what's been going on for a week or 2 weeks. So our cases are still going to continue to increase despite this order for a week or 2 weeks, and then we'll see it start to stabilize. So don't base your decisions of it didn't work in 2 days from now. That's not the science. You got to wait a couple of weeks before you make that decision, and then you'll see it flatten again. That's exactly what we need.
I got to hop off and reassign some reporters. So I thank you guys very much for your time today.
Happy 4th of July.
Thanks, Scott. All right, Marco says he's good. I think Mitch is joining us. Mitch Borden, there we go.
Hey, hey, Russell, I'm curious about your call with your community partners this morning. I guess, how did they sound after you announced your diversion program? And yeah, I guess that's my first question.
Yeah, they we rolled some of that out yesterday to the region, and I think first of all there was a lot of questions, and I explained to them this morning. Most of my career has been sitting in a rural hospital CEO's chair, and so I made that decision with a heavy heart, just because I know what it's like to sit in those chairs and wonder what you're going to do and how you're going to handle your emergency room and your patients, especially over holiday weekend. And the conversation was very quiet, to be honest. It was very quiet. But once we talked through it a little bit and spoke about the ways they could help us to help move this diversion off quicker, was by them being able to take these patients from their counties. I think that the message was received. I don't know if it was well received, but it was received, and they understand that we're trying to protect everything we can, because this is far from over. And if we don't manage it now, it's going to get out from under us, and we'll never be able to get it under control. And so we had to take these steps to make sure we could handle this a week, 2 weeks, a month, 2 months down the road.
And I guess, like, just my follow-up, knowing, you've sat in that chair before and probably, you would not want to be on the other side of that phone call. Did MCH have any recommendations for rural hospitals on where they could send their patients if they needed to over the next week, or however long you guys divert patients?
Yes, we did talk a little bit with that yesterday with a few of our partners, just about, that question was asked exactly, where do we go? What do we do? Our first comment was to send them to our friends down the street at Odessa Regional until they fill up. And then when they get full, then they need to reach out to San Angelo and then probably Lubbock and El Paso. But we definitely encourage them to bring them, to get them here to help our friends out. But if that's full too, then there's other options around. And before we made our decision, we did call around to Lubbock and San Angelo just to see what their load was, and we felt comfortable that they could handle what we have or what we would have come out of here.
And I guess this is an open question to everyone here. And this may not matter with the mask mandate from the state, but you guys have been talking about wearing masks and washing your hands and staying away from people for months now, and it's always been important. But there's been an increased sense of urgency as we've seen cases rise. And I guess over the last week, how do you think Odessa has that urgency fallen on deaf ears, in your opinion, or do you see people reacting and see more masks out in the community?
I think somebody said on here yesterday, but I noticed it too, being out. I can see a difference. Used to, when you went to any of these big box stores, you could tell who the healthcare workers were because they were the only ones wearing the mask. But now I was out yesterday and I could notice that, it still wasn't 90% anywhere close to that, but it was enough difference to get my attention to think, man, there are more people putting them on. And I think somebody talked a little bit about that yesterday, but I paid a little closer attention to that as well. And you can see it out there that there are more that are putting those on.
I think the other thing too is, as we have more positive cases, different people in the community who maybe didn't really support it or didn't believe it, whatever the case may be, now that it's hitting closer to home, we're getting a little bit better compliance as well.
And Mitch, I think we're all hopeful too. I think Dr. Saravanan had addressed this earlier in the week too, is this mask ordinance or this mask mandate from the governor isn't going to just magically solve the problems, isn't going to magically make the people who are staunch against wearing masks, but if it helps improve the people wearing a mask by 10%, 20%, that's another 20% of people that aren't there spreading this virus around. So it could make a little difference, and it's not a difference we might see, like you said, overnight or in a week, but it's something that it certainly won't hurt.
Oh, of course. Everything always being, and I think those are all my questions. Thanks, guys.
Thank you.
Thank you, Mitch. I think that's pretty much everyone, unless William, did you have any questions? I know Scott asked questions for CBS, but I didn't know if you wanted to join and ask questions as well.
No, I'm good.
Okay, awesome. Well, I think that's everything. Somehow Facebook didn't time out today, so if we didn't have to reconnect, so that's good news. We know July 4th weekend upcoming, and we saw what happened after Memorial Day, and we're still dealing with that. Stacy, Kristen, Russell, do any of you have messages for the community as we come up on a typically big weekend where everybody goes out and celebrates, a message to the community as we head into this weekend?
July 4th should be a reminder to us all that all gave some and some gave all. And in this scenario of wearing a mask, we all need to give some, put our mask on, and protect each other.
I completely agree. I don't really have anything additional to add. I think everyone knows what they really need to do to keep our community safe. And so let's just get it done.
I agree.
All right, well, thank you guys for being here this week. I know we did 3 times. We'll be back to Monday, Wednesday, Friday next week as of right now. And of course, we'll be updating the media should anything change over the weekend. Russell, did you want to finish this out?
Romans 12:10 says, be devoted to one another in love, honor one another above yourselves. Take care of each other.
Everybody have a good weekend. We'll see everyone back here on Monday.